Folks, welcome back to another episode of the IMGPH podcast. Today we have someone who did his bachelor's in nutrition science, where he dove deep into the world of personal training, wellness, nutrition. And surprisingly, after that, he went and he did a master's in sociology. He developed a deep passion to help members of the Black community. He believes in equal portrayal of such communities and wants to be a representative to create discourse over such issues such as criminalization, mass incarceration, poverty, which are all public health crises in and of themselves. And now he's here at NYU GPH pursuing a master's in public health here with us at GPH. We're glad to have you here, Leroy Akoto, and so excited to learn about your journey. Welcome to the IMGPH podcast.
Thank you for having me. I'm excited to be here.
So, I got to ask you, it's rare. We have a nutrition program here at GPH that I hear about, and I've spoken to some people from that. You started your journey in nutrition and you were a personal trainer, probably making people lift a lot of weights, run. They probably wanted to run away from you as well. What was that whole journey like? How did your interest in fitness start, and in the beginning, before we get to how you got where you are right now?
Yeah, so my journey and my interest with fitness began with the fact that I played football in middle school and high school. So growing up, it was a lot of weightlifting, a lot of, meat and potatoes and all that sort of stuff. I was also a heavier person growing up. Especially in high school, and my weight fluctuated. It was either 250 pounds in solid muscle, 250 pounds of sort of sloppy, 190 pounds and just a lot of fluctuation, a lot of back and forth with my health, with body image and confidence and all that sort of stuff. So when I got to college, I made the decision right there and then. It's I'm going to focus only on being healthy, being active, eating, and all of that sort of stuff. And I also get into college, I didn't know what I wanted to major in. So it was between journalism or psychology. It was the two majors that people pick before they really figure out what they want to do. So I stuck with psychology for a semester, and then I switched to biology. And then I made the decision to switch to nutrition because I was I'm good at nutrition. I don't really have aspirations to be a doctor. So I wasn't on the pre-med route. And a lot of the bio classes I had already taken, also you take with nutrition. So it was a really smooth transition. So all of the prerequisite classes, the orgochem, the inorganic chemistry, physics, all that sort of stuff I had already taken. So by my junior year of college, of undergrad, I was just taking all nutrition courses, macronutrient, micronutrient, nutrition, biochemistry, dietetic courses, physiology, stuff like that. So it started off with, again, just my own personal journey, trying to be healthy and stuff, and then deciding I want to really help other people become more healthy. So yeah.
What was that world like? What was it like working with other people? It starts with your own health, like you mentioned, 250 muscle, 250 sloppy, 190 all over the place, and then you figured it out for yourself. What is it like working with other people in that industry?
For me, working with people directly, I enjoyed it, and it was it's a field where if you're going to get into it and you're getting into it for the right reasons, not the Instagram followers or the hundreds of thousands of dollars in the sponsorships and supplements. If you're going to get into that field for the right reasons of helping people be more healthy, you have to be very empathetic. So for me, it was just very, very enjoyable because I got to learn a lot about other people. Literally just got to learn about other people, and learning about other people is then what allows you to help them achieve their goals. I worked a lot with the general population, so it was a lot of 9-to-5 working individuals, 45 years old and above, and all of that sort of stuff. They just wanted to move. They didn't care about fitting into a dress or fitting into looking good on the beach with 6-pack abs. They wanted to just be able to move and age gracefully. And a lot of them grew up in a time when there was a lot of misconception about nutrition. Is it sugar that we're afraid of? Is it fat that we're afraid of? How much should we be eating? What should we be eating? All of that sort of stuff. So for me, it was actually very inspirational. They really inspired me. They say I inspired them, but I was really inspired by them. Just seeing the excitement in their face when they're Leroy, I wasn't able to do, a push-up, 5 months ago, and now I can do 20, I could walk up the stairs without losing my breath, all of that sort of stuff. So in that sense, it was very inspirational. But again, it was personal training as well. So there was the business side of it. There was the sales, all of that kind of stuff that, I just wanted to help people, but, overcharging them to the point where they're unable to afford the services and everything. That's what really took the passion out of it for me.
You mentioned I see why you left it, and I'm excited to hear of how you got into sociology in a second. There was this part you mentioned about misunderstandings of sugars and misunderstandings that people might have about the health and fitness space. When people ask you what are some misunderstandings or misconceptions, what are the first few that come to your mind?
First is calorie counting. So there's for me there's so many different ways that people go about calorie counting, but I put it just into two categories. There's the I'm eating healthy, so I can eat whatever I want, and I can eat however much of it I want. And then there's the 1,200 calories and no more type, So pretty much starving yourself, and then there's the, again, I'm eating, the healthy foods so I can eat whatever I want and all that sort of stuff. And in that, then comes like the understanding of what is actually a diet. So diet is literally like, the foods we eat to make up, like the way we get our energy, the way we get our nutrition and stuff like that, as opposed to like the actual fad diets of like low calorie, low fat, and all of that sort of stuff. So really, when you say, "Oh, how's your diet?" and all of that sort of stuff, we're not asking how many calories have you counted today. It's like, what consists of your eating? Is it fruits? Is it vegetables? Is it, protein? Is it animal-based protein, plant-based protein, nuts, legumes, all of that sort of stuff. So throughout my time, and like my time with like nutrition and all that stuff didn't just end with my stint with personal training. I worked for Noom, the health company Noom, for 4 years, and that's where I really work to help people like rework their understanding of eating and of diet and all that sort of stuff. A lot of people will be like, I was on this diet for 3 years and it didn't work because I gained the weight back. And it's like, usually these fad diets call for you to cut out certain foods. So like you lost a lot of weight because you didn't eat like any fats for 3 years. Your body needs fat, You lost a lot of weight because you didn't eat carbohydrates for however many months or years. Well, your body needs carbohydrates. So what happens when you start reintroducing these foods, these macronutrients back into your eating, back into your lifestyle, it's going to cause you to gain the weight again. It's not that the diet didn't work. It's just that diets don't work. You have to actually change your lifestyle. I know it sounds corny when people are like, it's not a choice. It's a lifestyle. I do this, a lifestyle. But like, it really is like, you have to like, learn, and you have to do it for yourself. You have to learn what you want to apply, what you want to change, and all that sort of stuff. I know my body type. My body type is, lean and muscular if I like, focus more on like more of a caloric deficit, but like I'm intentional about it. I'm not just like starving myself to like fit into, a pair of pants for like, the summer and then go back to whatever I'm eating later on. For other people, it's, slow, steady, complete balanced diet, 30% of every single thing. They don't even have to work out. They just know that if they reduce some of this or like if they include some of this, then they'll get the results that they're looking for and stuff. You can't, get on social media and say, oh, so-and-so did this, so I'm going to follow this and then I'm going to get the same results, because it won't work. You can definitely look to other people and the successes that other people have had and use that as a form of guidance, and then you start applying what works for you into your journey, into your lifestyle. You just start following it in that sense. So
I mean, you're very well informed, and what most people don't know is you did this a long time ago, and now you have done 1,000 things after that. So how did that transition into the world of sociology happen for you?
yeah, so like I mentioned earlier, I just knew that I wasn't going to go to med school, and I was just sitting with a nutrition degree, and I was like, and this was at the time, so graduated in 2016, we know who was president from 2016 to 2020. And for me, it wasn't really just the presidency. It was just like the overall discourse that was happening on social media, on the news, the people I'm speaking with. A lot of, like I mentioned, a lot of the population I worked with, they were older white individuals that were, pretty disconnected from, the struggles of, a lot of minorities and all of that sort of stuff. For me, I just realized like I'm pretty passionate about a lot of these things. I'm very passionate. I'm not going to hop on social media and get into a debate with somebody, but just for me specifically, I'm really passionate about it. And I just kept asking myself, like, what can I do? What can I do to like, help sort of like generate change in society? How can I like, inspire other people? How can I make it so that, younger kids that look like me, younger kids that, look like other, minorities and marginalized groups and stuff like that can not only grow up in like in a better world, but grow up with like the inspiration and the idea that like, yeah, we're gonna continue to generate change, as we get older and all that sort of stuff, not just be complacent with where we are. So I started looking into so many different ways I can get into it. Do I go to law school? Do I go, do I study mental health and become a psychologist? What can I do? And sociology stuck out to me because it's like a very, very, very interdisciplinary study. You can do so many things with sociology. There's like 8 main branches of sociology that a lot of people focus on when you go into the field and stuff like that. And sociology in general is literally it's the study of society. It's a social science that studies society, that observes society in so many different ways. So once you get into the field, then you have to figure out what study of society do you want to engage in. And I engaged in social stratification. Why is it that we are stratified the way we are in society, in our communities? What determines, or how is stratification determined, or how is stratification applied, and all of that sort of stuff. So just wanted to do more, wanted to get more out of life, and then hopefully inspire others to get more out of life is what led me to sociology. That's like very, very big interdisciplinary study. And then once I got into sociology, focusing on stratification and focusing on social deviance is what, led me to my focus here with GPH.
All right, we'll have to take a step back from that one. So, what is social stratification and all these things you mentioned? How can you simplify that?
Yes, of course. So social stratification, in the simplest terms, is literally just how society is divided. Like the word stratified, just divided. So by class, by culture, by race and ethnicity, and demographic as well, income, all that sort of stuff. Like how are we, divided and dispersed, throughout society? But how do we also have this division within a society and then still also exist in one society and all of that sort of stuff?
Understood. Were there any experiences in your personal training journey that kind of coincided with the sociology part of things before? Or was it just I find interest in this and the presidency is led by this person and I've realized that there's an interest in this and I want to you completely switch directions? Was there some connective tissue with the previous career that you had?
No, not with nutrition or anything like that. But when I was in high school, my junior year, I took a sociology course. In my junior year of high school, my sociology teacher, she was awesome. We sort of like stay in touch again, now and then today. She's always congratulating me on things. We share the same birthday, so we wish each other a happy birthday as well. But yeah, I was very intrigued by sociology. But again, it was only for like one semester, and then nothing throughout college, stuck with sociology. And, a lot of people scoff at, the idea of sociology or the sociology degree. So the interest was there, but like the accessibility to like really study it and stuff like that sort of like went out the door. Once I got to undergrad, I was more, science focused. What can I study to get a job and all that sort of stuff? So once I just realized, nutrition as a main focus and the fact I'm not going to med school, like what am I going to do next? I, went back with sociology and I was like, let me really try to solidify myself in this field.
We've asked this question before. I'd like to hear your interpretation of it. What is sociology? Like, how can you simply describe what sociology is? It seems like you said there's these 8 pillars and you can describe a lot along the lines. How would you describe sociology?
The study of society. Point blank.
Bam.
Yeah.
Easy peasy.
Yeah.
So the study of society for you is what led you into your path of getting a MPH here, and you're at NYU now. So were there any pivotal moments that said, okay, this is the study of society and I have a degree in this right now and I want to go into public health? Where did that connect come in for you?
Yeah, the fact that I couldn't get a job with sociology. It's good for writing papers, and it's good to be able to like sort of like recite theory or sort of explain different forms of theory and all that sort of stuff. But in terms of the actual work that comes with it, a lot of it you have to like sort of like stay within the academic realm, which is fine. I do intend to stay in the academic realm, but almost like virtually zero networking when I was completing my degree, mainly because it was COVID. So like the second half I had to complete online and stuff like that. And And the other part was just, the job market they're not looking for sociologists, they're looking for people who have masters in social work or masters in, public health or registered nurses or, therapists and all that sort of stuff. So I moved to New York in 2022, and I was working at a charter school. And working at a charter school is where that, really helped me experience what I had already studied with, social deviance and, minority youth and exclusionary disciplines like suspension, expulsion, all that sort of stuff. I was working at this charter school, and everything that I studied that I said I want to try to fix, I found myself being a part of,
For those that don't know, what is a charter school?
A charter school is basically a school that someone's like, hey, I have a lot of money, and let me just build this academic institution. So it's different from public schools, and it's different from private schools. It's its own entity. They can create their own curriculum. They can, they're funded. They have, different stakeholders that can fund them. The individuals that start, charter schools, they're usually millionaires. Some are billionaires. So they fund the schools. They create, their own rules, how they want to insert academics into certain children, the children who decide to go there, and all of that sort of stuff. LeBron James started a charter school, the I Promise school. So yeah, it's separate from public schools and private schools. They're their own thing.
And then that's how you saw all those things that that were so evident to you before you even came to New York and started working at a charter school. You started noticing it over there.
Yeah. Honestly, I thought I was going to work for the Department of Education or something. And I was like, this is the best I can do. I got this charter school gig. So I worked there. I just, again, was seeing the disconnect between the faculty, the people who are designing the programs and the curriculum, and, the children, all that sort of stuff. So, yeah.
So was the Masters in Public Health over here the missing piece of the puzzle for you? Is that what you felt would take you to the next level that you were looking for?
I think so. Yeah, I definitely think so. Because of the fact that my focus, again, with criminalization and incarceration and just mental health, I want to address it on a more macro level, not a micro level. So, if I was this passionate, I could have gone to law school. I could have, focused on psychology. But my thing is I'm focusing on policy and how decisions are made that impact whole communities, and within those whole communities, specific individuals and stuff like that. The certain things that aren't addressed until it's time to address it. It's, for me, I say incarceration, criminalization, those are public health crises, not the individuals who are, incarcerated or locked up, they suffer from this mental health illness, or they struggle with, this physical health illness, like heart conditions and stuff like that. We tend to focus on those aspects as public health, issues, but it's the incarceration itself is a public health issue. The policing practices itself is a public health issue. So, yeah, public health, I would say, is the missing piece.
Did you know that before you came to NYU that these are public health issues, or did it surprise you that, I need a What was that surprise moment for you?
So the surprise moment was when I was like, oh, sweet, there are other people who are thinking the way I'm thinking. Wow. When I was studying this with sociology, with my final paper writing about exclusionary disciplines and the rate of suspensions and expulsions of Black youth, especially Black male youth, and all of that sort of stuff. My thing was, why aren't we looking at it from a larger scale? We're looking at it from the individual level. We're looking at it from the school, level, each individual school around the country, and it's why aren't we looking at it on a larger scale and everything? And then I come here and I'm I'm speaking to professors, I'm listening to students speak. I'm all over the websites. I have 30 tabs, 30 different NYU tabs of the different types of focuses I can have and everything. And policy, was the one that really helped round everything out, how do we address an issue? How do we bring about a policy to create the change that we want to make? Who do we speak to? Who do we involve? Learning in our policy class, we even have to involve the people who might completely oppose, our way of thinking or the things that we want to change, all that sort of stuff. So, yeah.
I'm loving this. So you've come here, and now is there a pivotal moment? Like, you've made these big switches, right, in your careers where, oh, I used to do this, and then I went to charter school, and now I'm at NYU doing a GPH. What's happening for you now? What is a pivotal moment that's happened for you at NYU?
Meeting the people that I've met, some of my classmates, and then also my professors. Dr. Silver, meeting Dr. Silver was, I would say, the most pivotal moment. I would say she's the closest thing to my teacher from my junior year of high school, where I'm just like,
Wow.
she gets me. Like, she has so many other things going on. She has so many other students that she works with, that she focuses on, and her own overall concentration with public health and all of that sort of stuff. But whenever I speak to her, she's like, I know what you're talking about.
Wow.
So
Wow.
yeah,
You got your high school moment here at NYU since you came here.
I guess so. Yes. Yeah.
Has your focus evolved? And for the folks watching right now, Leroy's in his first year in 2024. Leroy will graduate next year in 2025. So you've only been here for a year right now, and has your vision evolved for what it means to going down this path, what you want to achieve? Has that changed a little bit? Has that evolved, enhanced? What do you think? How do you think of your goals right now?
I think my goal at first was to get, into public health and then just see what's out there, But now that I'm here, I've sort of like solidified the areas I do want to work in. Like I mentioned again, I'm in the policy concentration. So whether it is working with representatives, like elected officials and stuff, to try to generate change, or working with like nonprofit organizations or even private organizations, depending on the type of work that they do. Um, I wasn't sure how I was going to apply what I was, studying to like the actual work that I want to do. But I wouldn't say my sort of like my concentration or my focus has changed. I would say it's been enhanced since
Wow.
getting here. It's really shed light on the multiple opportunities that are out there and how I should be, or how I could be, taking advantage of it and stuff.
Are there any classes that gave you that perspective? Any life-changing classes you've taken so far?
Yeah, so healthcare policy, last semester in the fall, it's a half a semester course. So that's where I did meet Dr. Silver. So healthcare policy. And then right now I'm taking the actual public health policy course. And I'm also taking this criminalization and public health course. It's an elective, but it's one that it's amazing. Like, I went in thinking, oh, not that I was an expert like with criminalization or incarceration, but it's like sort of like you sign up for these classes and you're like, I want to, sort of like check my understanding, check my thinking, and see what I can take from it so I can apply it to my thinking. And nah, this professor, Dr. Dahlia Heller, she has introduced a new way of looking at incarceration and criminalization, for the better, for the positive. So those classes have really hit hard.
Teach us that way. What does that mean to you? Like, so someone that had been thinking about this all the time, their perspective changed. So what was that perspective? What was your perspective like, and how did it change?
I mean, for me, it's like I knew it wasn't always black and white, but I just always sort of like felt, the system was just built to, police and brutalize certain groups, certain marginalized groups, and everything. And Dr. Heller has, helped us understand that while we do want to focus on different ways to change the system, different ways of addressing the system and stuff like that, there are also different ways that we can approach what we're doing. So it's not just get rid of, like, down with the man and tear everything down, but really, really start applying actual practices and actual approaches that will then not only change the system but help it be sustained. So like restorative justice, for example, is a way. So looking at different forms of, like, bail reform, and all of that. Are we just going to get rid of bail, or are we going to also figure out a way to ensure that the individuals who are, consistent, characters in this system are left in a good, like, left in a good place in society once we take them out of the system and all of that sort of stuff. So it was always and then what type of approach that she has applied to us. Cause like, yeah, we addressed and we were aware of a lot of the conflicts and stuff like that, but she's also delivered to us an approach of like, okay, now let's figure out ways to like remedy everything that we've done and really, really, take the next step towards making sure we don't come back to what we've been, experiencing with the carceral system up until this point.
Wow. Not to downplay what you just mentioned, it feels like a holistic trainer in a way, right? Like kind of looking at things from different angles and approaching it holistically and not, hey, this solves the problem, go now.
Right. Exactly.
Yeah.
Exactly.
Wow. Is there any special community you have here at NYU that your people you interact with, any groups you're involved in over here?
Literally just the classmates that I have in the policy concentration. I think even though we all have different sort of like concentrations within the policy concentration, we just all love the idea of policy and public health. So we've just, stuck together, bouncing ideas off of each other. So that's the community that I've really stuck with. And, we're all a huge mix of so many different types of people, so many different backgrounds and everything.
Before we started recording, you were talking to me. I want to know about your next steps, right? But before we start recording, people watching so far must think that this is Leroy's area of interest. Leroy started in personal training and nutrition, went into sociology, and now is focusing on this part of public health. But you have a true screenwriter and artist inside you. I'd love to hear more about that.
Yeah. So, I love writing. Writing is the form of art that, I feel like, let me backtrack, not just writing, storytelling. So like, I love, telling stories and everything. So near the end of my senior year of undergrad, I just started journaling my thoughts, journaling my experiences, my struggles with mental health, sort of just like my understanding of what mental health is, or like, why did I struggle for like, from 15 up until now? Why do I feel better now? And all that sort of stuff. So I started journaling that, and I was like, let me just turn this into a story. Let me see what I can do, make it a story, because I know I'm not the only one that struggles with it. I know I'm not the only one that looks like me that struggles with it. And that is very big for me, making sure that there is, I'll say it like this, and I don't really care if it's controversial or not. Society is not very empathetic to Black men. We're not really empathetic to Black men. Even Black men who aren't, so I guess like sort of like committing crime or like being policed, we just always find a way to bash Black men, athletes, musical artists, we just always find a way to, it seems like we're always looking for a negative light to shine on Black men. So, I take issue to that, but not in the sense of trying to get into arguments with everyone on Instagram and social media and whatnot. My question is, what can we do to change it? And perception is huge. So when you look at shows and movies and you see a bunch of Black men just waving guns or, dealing drugs, or like even when they're the athlete, they have this sort of like cocky, unattractive arrogance to them and all that sort of stuff. My thing is, why they been written that way? Is this how society sees Black men, so that they're portrayed that way in films and movies? Is this how films and movies portray us, therefore that's how society sees us? And I was like, no, there's more to us. There's more to our story. I love Denzel Washington, Samuel L. Jackson, Morgan Freeman. I love all of them, but it seems like they're like the only ones that continue to be in movies. So my thing is like, what? So if you're a Black man, you have to wait till you qualify for AARP before you can be, in a show or movie and be put into sort of like that heroic role or like that empathetic role. So my writing, especially when it comes to mental health, specifically focuses on the way Black men have sort of like been neglected, the lack of empathy that we've been shown, and all of that. But moving forward, I have so many other stories, like sci-fi stories that don't really focus on mental health or race. It's just for everyone to like, really enjoy. But yeah, the screenplay that I'm working on right now is specifically on my struggles with mental health. And because I'm an anime nerd, I turned it into like a sci-fi fantasy sort of, I put a sci-fi fantasy spin to it where I struggled with the idea for a little bit because I don't like to romanticize about these types of things. I don't like to look at it like, oh, trauma is now my strength. It's like, no, like you're traumatized because you're traumatized, let's not, glorify the trauma. But that is one sort of like spin I did put to it, was that the fact that a lot of the individuals in the story have superpowers. Their superpowers came from some form of trauma that they've already overcome. So now they're utilizing their powers to help, make the world a better place and all that sort of stuff.
I love to see that creative side integrating with what you're doing at school over here as well, and with all the goals that have developed so far. So let's ask this final question. What's next? You have one more year left till you graduate. Probably when this podcast you're watching this podcast 2 years later, you must have already made that screenplay of yours that comes to life, and it must be doing great. But what's next for Leroy at the point you're at halfway through your journey at GPH?
Yeah, so I'm starting an internship this summer working with correctional associations of New York. So they are funded by the state. They observe the conditions of jails and prisons, throughout the state of New York. And the focus is, to help improve the conditions, make it a more habitable environment for the incarcerated populations, help assess, the access to healthcare and like the quality of healthcare that they have access to. And then there's much more, but that's the brief overview of what Canny does. So I'm going to be working with them this summer, and just continuing that sort of work down the line. With the screenplay that I was telling you about, I wrote a short to help sort of like promote the screenplay, and it's also like a scene from my screenplay. I'm gonna try to like start casting and filming for that this summer. And then, just being a nerd, academics, folks staying on top of that, trying to be financially responsible because I am currently unemployed. So by choice, but, want to make sure that I stay responsible in that sense. And just, enjoying my, last year of my 20s.
I love it.
Yeah.
Folks, that's another multifaceted student we have over here, integrating arts, sciences, the future of public health. Leroy, thanks for being on this episode.
Yeah, thank you for having me. I really appreciate it. It's a great time.
It was awesome. All right, folks, like, subscribe, anything that you'd like to see on the next episode, any questions you have for Leroy, we'll put all the info in the description. Shoot a comment, and we'll see you in the next episode. Take care, everyone.